Speaker meeting. I have been president on and off since 2005. I've retired a couple of times and they bring me back. So I think that this will be my last meeting introducing your speaker. Most of you that are on know about NAMI. It's the best stigma fighting organization we have, and it reduces guilt and shame in individuals that believe they caused the illness in their relative. And it reduces guilt and shame in people who get a diagnosis. And we're a community that people can be authentic with, they can be real, they can share their vulnerability, and there are no judges in NAMI. There are no judges. This road moving through with a mental illness in the family midst is a road of uncertainty, frustration, despair, anguish, hope, trust. I mean, it's full of everything, but for sure it's an uncertain road. So I welcome you all to a NAMI meeting and probably one of the most fabulous speakers we've had in a long time. I want to introduce you to Mark Ragins, Ragins, and he is the author of the book, Journeys Beyond the Frontier, A Rebellious Guide to Psychoses and Other Extraordinary Experiences. And, Mark Ragins is brilliant, and he has humility, and he has softness, and he likes to relate to people. He relates. And he's the kind of psychiatrist that could have been in Beverly Hills and made a fortune. But no, he chose to work with Mental Health America in Long Beach, and he started an organization called The Village. And people with brain illnesses or problems, they were dealing with depression, anxiety, schizophrenia, bipolar disorder, could just drop in at The Village. And Mark would be there at a big kitchen table, and he'd have lunch with them. He'd hang out with them. They never had separate staff restrooms and client restrooms. They were just all a big family, and everybody who went to The Village and hung out there for a day got to feel very comfortable with this really brilliant psychiatrist. And he never sat across a desk and talked to people. He would engage him. And his book is about engaging those individuals with psychosis. Psychosis is one of the cornerstones of having a mental illness. Psychosis really means just having beliefs, visions, experiences shared by no one else. Only that person is experiencing them. So he encourages us in his book, Journeys to a New Frontier, to engage the psychosis, get to learn more about it, ask questions about it, be curious. I mean, his book is truly revolutionary, and I wish every psychiatrist would read the book. And I think every family member who has a mentally ill relative should read this book. It's very illuminating. It's fascinating. It's a book you can't put down because these real stories of real people are so compelling. You have to keep reading the next chapter and the next. So Mark Ragins we used to put on something in the west side of town called the Pathways Conference. We used to do it at temples. We used to give big pathway conferences at the Jewish University up at the top of Mulholland. And we often invited Dr. Mark Ragins to be our keynote speaker because he was so fabulous as a speaker and because he was so humble and so honest and so real and so authentic. So I give you one of the best authors and one of the finest psychiatrists in America, Dr. Mark Ragins.
Well, I think thank you for that lovely introduction. I may have to pay for it with everyone's very high expectations along the way, but I all kidding aside, I do appreciate the very kind words, Sharon. And I appreciate you guys for showing up. That's very cool along the way. I want to spend this evening sharing with you guys a presentation about the material in the book. There's to give some idea what I'm thinking about in the structure of this, and the presentation can stand on its own whether you like reading long books or not. So when I was in high school back in the 70s, if you were a smart kid and good at math and science, there were two kind of visions that you could pursue. One is you could design a star warp engine that would go faster than speed of light, so you could be like in Star Trek and travel different planets and do that. And the second one was that you could find the cure to cancer. Now, they haven't come up with the star warp engine, and I actually think that's probably impossible. But in those years, the 5-year cure rate for cancer went from, of all types, went from 20% to about 80%. Really rather remarkable in the last, 50 years. But they did it not by finding the cure to cancer. Nobody has the cure to cancer now, as though we found the cure. They did it by breaking it down a lot, by looking at different types. Where's it from? Let's find what the factors are. This one has to do with smoking. This one has to do with a virus. This one has to do with hormones. This one has to do with sun exposure. This one has to do with gut flora. This one has to do with your immune system. And they broke them down, and whittled away to be able to make progress. And they looked at different stages of the cancer, how you could intervene along the way. Now, I wasn't that interested in cancer. My interest was in psychosis, because I think our mind is the most fascinating thing, and psychosis is the most fascinating part of it. How do you get your own world, like Sharon was describing there? And we haven't done so good finding the cure to psychosis in that last 50 years. We've had tons of brain research, probably not as funded as well as cancer, but we've got brain research and scans and all kinds of things. And we've got a bunch of new pills. And our success rate, I don't know if it's any better at all than it was in the 70s. Some people, yes, some people, no, hard to tell. But what we haven't done is started breaking it down. Everybody says, well, schizophrenia is like 20 different conditions or something. Well, why don't we break it down? And what stage are you? Where are you? What kind of factors? What's each individual person? We keep it as one giant lump. What if they would have left cancer as just metastatic cancer, and we don't care where the original one is or where it came from or what's different about the different subtypes, and we just do the same kind of chemotherapy for everybody, no matter what you come in for? They probably wouldn't have still be terrible success in working like that. And what stopped us from really getting down there and trying to understand this person? Is their psychosis more from how they process the world? This person, is it more from severe trauma? This person, is it more from drugs? This person is a more developmental process. This one, is it more a genetic illness? This one, is it a medical condition or part of a delirium? Why don't we break down carefully? And how did this start anyway? And what happened before that? And how has it progressed along the way? You know, we do a rather cursory evaluation. You come to a hospital or something, ask you some checklist of questions, and then give you the same set of chemotherapy and maybe some rehab if you're lucky. Why don't we take the interest and spend the time and really get to know people along the way? They spend thousands of dollars evaluating people with cancer, and we can't afford to spend, a few hours to really get to know somebody, really get to know their families, really get to know the people who know them. Why not? And that's where I want to start this presentation of why not, what are the barriers? Because if we can't get past the barriers, we can't start breaking it down and really understand what's going on. So with that as my beginning, let me see how good my technology is to find a share screen to show you slides so I can make this work. All right, hopefully everybody can see the slide now. That's a picture of the book this goes to, and also listed here, if you're interested, that markragins.com. All the articles I wrote in the 27 years at the Village and 5 more years at Cal State Long Beach now, I've put them there organized along the way that you can download things for free along the way there. There's also some various connections to some videos and some YouTube lectures on there as well. It's not that greatly put together because I'm doing it, but it's got a lot of information there. So part 1, overcoming barriers. I want to talk about 4 barriers. The first barrier is fear. Psychosis is beyond almost anyone's comfort zone. Nobody goes, oh yeah, I'm really comfortable with psychosis. I just walked into it, was fine. It felt comfortable to me along the way. There's a few people like that, but not everybody. It's like, those old medieval maps. It's off the end of the maps. And when on the end of that, they put like these sea dragons and monsters and stuff. Here be where the monsters lie. And what do you do with monsters? You either lock them up or kill them. You don't like befriend them and connect with them and explore them and curious about them. It's out too far beyond the comfort zone. We still lock up tons of people in hospitals for either danger to self or danger to others. That's the main thing you end up in a hospital for. It's about the dangerousness. And on the staff side, and sometimes families as well, we're told, don't talk about their psychosis. You'll just feed into it, make it worse. Be scared of even connecting to them. Don't dare explore this. They'll lose control. You'll make it much worse. Don't feed in. The picture I've got here is just what you find if you do one of those search engine things for psychosis, or maybe with schizophrenia, I can't remember. And what I want to point out about this one is the underlying messages here. They got the criteria there for psychosis, and they got a picture of that young girl with the short skirt on back there. Now, I guess it's easier to show a visual hallucination than an auditory one on a picture, but how many people actually have auditory hallucinations of attractive women walking by? That doesn't seem, or visual ones of attractive women. Lots of guys have fantasies about that, but not so much hallucinations. And the guy there, does he look like he has a lack of emotion to you? Is this blunted, or is he like barely holding in his emotions with these clenched fists? And he's barely holding in real. Well, what's he trying to hold in here? And then you realize the reason the girl's there, because he could be attacking her, or thinking about raping her, doing something here. The underlying emotional thing to hear is, watch out, this guy could be dangerous. And I didn't even find like a horror story here. I didn't go say, look at Amazon.com for my book and notice that half all the books about psychosis are horror and violent thrillers and not actually educational things. This is just what you get on the standard search engine. It's so built in, this fear. We still send police. Maybe when we do 988 starting next year, we'll start not saying, but right now, every time it's police and guns. The second one we've got problem is we think psychosis is incomprehensible. You can't understand what those people are talking about. It's gibberish. It doesn't mean anything. Don't bother trying. Actually, the word psychosis, I looked this up. You tend to look up things when you're writing a book. I looked this up and found that the word came out in the 1840s, and it meant people had a bunch of mental problems that you couldn't understand. They seemed to be out of it and strange, but they didn't get like kicked by a horse or shot by a gun or something. What's wrong with them? Even when you cut open the brain, you can't find too much wrong with it. Even when Freud comes along with his psychological theories and stuff for neurosis and the dynamics and stuff, so psychosis I don't really get. I can do neurosis, but not psychosis. That's beyond comprehension. And even the fancy biologists, they can't find reliable biological or genetic markers. They come up with 2,000 markers, which is actually probably the 2,000 things used to understand reality. That doesn't mean those are illness markers. Those are processing markers. So it still today means somebody has something really wrong with them, and we can't understand it physically, we can't understand it psychologically, we can't understand it biologically. We don't get it. Because we're not trying to understand it mentally by actually connecting. Look at this picture. This is just from a standard British textbook thing about schizophrenia overview. Look at that picture. What is that supposed to be? Some kind of space age thing, as though technology is going to rescue us here with a fancy enough brain thing. And what are those little white things spinning around his head anyway? There's no real understanding here. There's just a dazzling with technology as though that's going to rescue us from the process of just sitting with someone and understanding what they're going through. The third barrier here is we feel like you can't connect to people who have schizophrenia or psychosis. They're in their own world. I can't connect to them. I can't talk to them. It's too weird. Actually, the word schizophrenia was made up by a talented psychoanalyst, Eugene Bleuler, back in 1908. Split and schizophrenia was feelings, not split personality. And he's the one who invented 4 A's of schizophrenia. Affect means their emotions. Associations means how words are put together. Today we call this a formal thought disorder, but do the words make a rational sense? Can you follow the words? Ambivalence means they have trouble making decisions or processing things to decide and will. And autism was another word he made up for someone who seems to be in their own world and not connecting to you. Now, notice something about this. He's not talking about hallucinations or delusions at all. He's just saying, I'm a really good psychoanalyst who's really good at really getting into deep worlds underneath and understanding dreams and all this stuff. And I can't connect with these people. They got weird feelings. They put together things incoherently. They have trouble making decisions or processing, and they seem to be in their own world. And because he made that decision, I can't connect to them. Obviously, I can't help them therapeutically. And obviously, it must not be a psychological process. Kreplin must be right. They have a neurologic disease that's deteriorating and hopeless. Someone's psychotic. I can't connect them. I can't help them therapeutically. By the way, as a small aside here, CBT for psychosis. The CBT is still working on how your thinking is, your cognitions and stuff. They invented for depression. They used it for panic and for sleeping and for anxiety. And someone in England started using it for psychosis. And when they did the study to show that this was helpful, they put in something called befriending as their control group. Just have their staff hang out for an hour once a week with people, just being nice and talking about cricket and acting like you care about them. When they did that, when they connected 1 hour a week for 6 months, those people had a third reduction in their positive symptoms, their hallucinations, delusions, a third reduction in their negative symptoms, their passivity, being out of it, and a third reduction in their depression, as though you would put them on Clozaril. Not only is connection possible, it's incredibly helpful. This picture is from a guy named Dan Fisher, who, if you don't know, write down his name and look it up later on. Dan Fisher is a man who recovered from schizophrenia. He got schizophrenia. He was an MD, PhD. He was working in the fancy NIMH labs on neurotransmitters. And the more he did this work, the more isolated in the lab, longer and longer, he started being convinced he didn't have any will or any self-power to himself. He was just made out of chemicals, and he was a robot. He became totally catatonic, couldn't move because he was just a product of his chemicals. There was no personality or emotions to him. It's just a biological thing. They put him in psych wards, said he had schizophrenia, tried meds and stuff. It bounced around, didn't do so good for a while, until he said, you know what? I'm wrong about this. I'm not just biology. I'm not just my chemicals. I'm a person with emotions. I'm going through an emotional thing, and I better stop going through it alone. I better start connecting to other people. And this picture is one of his drawings. I copied it off a napkin he drew with, and we both have the same artistic skill. So I've captured the classiness of this drawing here. And I like this picture because it just touches me. You can just see the guy whose feelings are going around in a circle. He's talking to himself. His thoughts are going around, just miserable in his own world, and how it just opens up when you have someone else to share feelings, share your thoughts, talking with opening up. He, by the way, recovered entirely from his schizophrenia. He became a psychiatrist. He works fine. He's married. He's got kids. He's on no meds. He has no symptoms as far as I can tell. And a very successful life. And he invented a few different things about how to do connecting to people. Huge fan of peer support, huge fan of something called emotional CPR, and a huge support of something called, oh shoot, I've forgotten an acronym. It's for progress at your own pace. PACE is a recovery program. Fourth barrier. People with psychosis that goes on for more than 6 months are hopeless. Where do we get this one from? This came from Kreplin, who was a German biological psychiatrist in about 1890 or so. He's working in a big hospital that actually a third of the people had neurosyphilis there. And he says, so we need to find the biology under these illnesses. He brings together all the neuropsychiatrists. Let's get together and find the neuromarkers. What are the various biological things? This conference is a terrible failure. Only one person manages to come up with anything that's worthwhile. And you probably know this person's name is Dr. Alzheimer. who comes up with the fibrillary tangles and plaques for people with Alzheimer's disease. So he's stuck grappling. He doesn't have things. Well, how do I know who's hopeless or not? It's well, the people have more emotions, seem to go up and down with their emotions and stuff, and I can connect to them more, and they've got more life to them. I'll call them affective psychosis and emotional psychosis, which became our bipolar. And the people who are less emotional and kind of divide themselves and stuck and negative in the corner, they seem to go downhill. I'll call that dementia precox, means they have a dementing illness that started when they were way too young and they deteriorate. And that's how we decided that schizophrenia was hopeless. Patricia Deegan, another person here who if you don't know, look her up. She's another person who recovered with psychosis. She's hugely about hope. She calls it conspiracy of hope. She says, you have schizophrenia, you'll be sick the rest of your life. You must use medication the rest of your life. This common message is a prognosis of doom. Many people reject this hopeless forecast by rejecting the medicine. And rejecting the medicine, they reject the prognosis of doom as well. He says, no wonder you have so little chance of getting people to stay on their meds when you start with, you're going to have to take this forever. I wouldn't be able to give a college student a pill of any kind if I started, you have to take this forever. That's their first question is, am I going to be dependent on these? I don't want to take them. No young person would agree to this for any condition. And the worst part is it isn't even true. Here's a piece of data in this. I promise the only thing with numbers on this slide presentation. This is hot off the presses. I got the year here. I think it's, I want to say 1989. I don't have it on my slider. I think it's 1989 or maybe 87, 1987. It was when I was in residency. They closed the Vermont State Hospital. They first came out with Thorazine. Some of the people got better. They let those people go. Then there was a bunch of people left in the ward who did not get better. The governor said, oh, good, I want to close the hospital anyway. And the doctor said, no, these people can't go. They didn't get any better with any medicine. They're just terrible. This is 168 of the worst people the doctors didn't want to let go had been in the hospital for a long time. All diagnosed with schizophrenia, even when you look retroactively at their charts. Courtney Harding did this work. This is not obscure work. This is done from Yale and the American Journal of Psychiatry, a bunch of journals. She goes around in her van and finds like 90% of them, or at least finds people who knew them a lot 20 years later. Look at these outcomes. 20 years later, 83% had not been in the hospital. 2/3 have friends. 3/4 have close friends. Half of them have been employed. 3/4 of them have slight or no symptoms. 80% are meeting their needs. They're leading a very full life. Slight or no impairment for over half of these backward. And by the way, this is not because they invented better medicine. These people hardly took medicine. Some did, some didn't. It was all over the map. And this is not a rare study. Anytime you do a study of long-term psychosis, you can get rates like this of 2/3 to 3/4 recovery. This is not a new study. This is not taught anywhere. She's been hooted out of psychiatric grand rounds because, in the words of my mother, I'll see it when I believe it. People don't believe psychosis is hopeful, so they don't see how hopeful it really can be for a great number of people. So we got 4 barriers: fear, incomprehensibility, lack of connection, and hopelessness. No wonder we don't go analyzing, detailing, and connecting and doing stuff. You look at our DSM-5, it doesn't, those criteria, those don't explain anything. It just says you got these psychotic symptoms and it went on for more than 6 months and you're deteriorating. It's not explaining things, it's enshrining these problems. It even says if you could explain some other way, don't put them in schizophrenia. Everybody in schizophrenia just has these problems, it goes on, and they can't function. That's not an effort to actually explain what's going on. That's just putting a label and enshrining these barriers. So what's our choice? If we're going to wander beyond the edge of the map where the monsters lie, we need a new compass besides fear, incomprehensibility, a lack of connection, and hopelessness. First one is, instead of let me get this out of the way. I can't see my thing. Instead of being fear and avoidance, come with respectful curiosity and caring and start exploring what have you gone through? What's your life like? What is it like to hear voices or to have time frames that you live in two different frames at once? What's it? When that person I just met with the first onset of psychosis last week, when the girl rejected you, how did you end up thinking that people were talking about her and all paranoid behind this? This happened to you? Let's be respectfully curious and caring about what happens to you. Uh-oh. Did I ruin my thing here? Next. Instead of giving a dehumanizing diagnosis, it doesn't explain anything. Give a formulation, and I'll talk more about this in a bit. Give a story of their life, a history of how they got here. At the beginning, what developed, how did it go, what went badly, what went better, how are they recovering, what's the obstacles, what are the things going into it. This individual story of who they are, not just a label of everybody who has hallucinations and delusions for more than 6 months and we gave up on them. Instead of isolating them and saying they can only live with other people with serious mental illnesses or with their families or hang out with other people with mental health staff, help them build connections and relationships, other people to be able to connect so you're not isolated, you're not paranoid, you're not all by yourself. And last but not least, stop feeling like we're helpless and hopeless. We can help people grow and hope and build recovery. And if we go wandering these seas far away from our comfort zone with respectful curiosity, with trying to understand and build a story of their lives, with trying to connect to people, and with hopefulness, we're going to get to very different places and we would have a chance of accomplishing what people with cancer did. Remember when they thought those same things about cancer, frightening and incomprehensible, they did crappy too. They started doing better when they were hopeful and connected and thought they could actually understand what's going on. All right, so with our new compass, let's go out there and let's see if we can understand what's going on. Let's see if we can build a model here. And I want to start maybe in a strange place, not with the hallucination delusion. Let's not start with the metastatic cancer after the psychosis spread all over your whole self. Let's start at the very beginning when it's little. That's what they try to do with cancer. Is it start in your lungs? Does it start in your liver? Where did it start? Psychosis rarely rapidly emerges unless there's a huge stressor that happens. And frankly, when it does rapidly emerge, it often does really well. You got a really good chance of it going away and getting better. But the people who struggle the most are the ones who it starts really slowly with the so-called prodrome, where they just seem to be kind of weird and distant and not functioning and disconnecting and staying in bed all day, not taking care of themselves, not interested in things a little more, kind of strange things. They just sort of drifted away. And you go, how did we get here? It just drifted away along the way. Now, notice something. We could think about that as, well, it's going to lead to the psychosis, a psychotic thing, rather than losing all your relationships and your sense of self eventually led to breaking down into hallucinations and delusions. We could call this a relationship condition that leads to hallucinations rather than a hallucination condition that's preceded by relationship problems. Now, let me give an example of that because I probably lost some of you in the way I just smattered that one around. So let's take AIDS. When AIDS first came out, we didn't know it caused AIDS. We knew that people came and they had a really terrible immune system and they got all these strange infections, Kaposi's sarcoma, they got pneumocystis pneumonia, and they withered away and died. And they couldn't be any immune system come on. And it wasn't something you were born with or came from the inside, something you acquired as infections. So the name of this condition, as we just give back fancy words for the things, is acquired immune deficiency syndrome. After a while, they figured out that this was caused by a virus, it's caused by the HIV virus, and that really, if you want to treat it, it's a good thing to actually treat that virus, not treat once you already have immune deficiency and all these things going on. Can we prevent the virus? Can we invent a vaccine? Can we invent pills that we have ways of avoiding getting it by how does it pass along with sexual contact and needles? Can we do things that kill the virus and doesn't let it spread as much along the way. And so we stopped it because we said this was a virus causing immune deficiency rather than immunodeficiency condition that was preceded by a viral infection. That first part of your relationships falling apart and you're losing your identity is not incidental. It's a great deal of the cause of the later problems. So if we keep that in mind, let's put together a triangle here that says there's 3 dimensions to psychosis. The one is the one we always talk about. You experience reality as stranger. That's what Sharon was said, introduce this as. You have your own perception of things. You have an unusual experience of reality. But someone who just has an unusual experience of reality, we don't necessarily call that person psychotic. If someone's colorblind, we don't call that psychotic because they experience the world differently. If someone's deaf or ringing in their ears or someone talks to God, we don't call that psychotic. It takes more than just an unusual experience of reality. It takes 2 other things. One is they start losing their self-identity. You start talking to someone who's had a long psychotic illness, they tell a nice story about when they were teens and when they grew up and stuff, and then it gets really vague. What happened those years in between? What along the way? Where were you? What happened? It's kind of like you can't put it together. And they're kind of vague after a while. They don't seem to have as much to them or as much personality or as much passion. That's kind of in these few things, and in between that, that's a lot of empty space. They've sort of lost who they were. Their dreams are getting together many times. And you look at their relationships, and usually they've gone really badly. They become really isolated, maybe just a family member or 2. They become paranoid and distant. They're kind of frightened of other people. They just, I'm fine, stay away from me, nothing. They talk to themselves or their voices rather than talk to anybody else. And my claim is psychosis is when all 3 are broken. We don't say you're psychotic when you just don't know what you're doing with your life, or if you just are an isolated person, or if you just have unusual beliefs. All 3 have to fall apart for the person to really be psychotic. Any of the 3 can be the weak one that leads to it falling apart. So when we're talking about that prodrome, you can have somebody who starts losing track of what they're doing with their lives, getting more and more isolated. The relationships start falling apart, their identity falls apart, and then they start hearing voices they add in the pot, make it even worse, and pretty soon all 3 have crumbled. Or they have a giant problem with their reality. They start hearing voices, and that makes them afraid of everybody and paranoid and hide away. And then everything is tied in this paranoia, and the rest of their life disappears, and all 3 have fall apart, and you can't get it back together. Any one can be the one where it starts. Any of the 3 can be actively improved to help someone recover. You don't necessarily have to, we only focus on improving your experiencing reality is one. And we're willingly sacrifice the other 2. One of the programs for intervening with the people in the military at the beginning is we'll actively find your psychosis, take you out of the military, put you in the hospital, make you take meds, get rid of your commission, send you back home, do a little rehab, give you disability. We'll destroy all your relationships, all your self-identity, while hoping that just meds will hold it together. And it doesn't work very well. You can help someone with relationships, like Dan Fisher was helped, someone with their identity or experiencing reality. And any of the 3 can be the strength that stops them from relapsing once they pull it together. Yes, meds can stop people from relapsing, or staying away from drugs stop people from relapsing, but so can having a really strong purpose and role and mission of what you're doing. So can have a whole network of really strong relationships to hold it together. Science people need help on all 3 of them, but sometimes just one could help you not crumble. All right, let me do a couple examples here so you get what the point here is. These are not the actual people's pictures, they're just to jog my memory. This first one is Maria. She came from a small town in Mexico. Ever since she was a little kid, she could have an extra sense of who was being upset by something and what was wrong with them without even knowing. And the local curandero took her in and started helping her make little potions and things, herbs to put things together. She fell in love with a man in the village. They came here to Los Angeles illegally. and they had trouble finding jobs. They were very poor, had all these problems. He started drinking, started beating on her. They had this kid. The relationship fell apart. She's making a little money. She's working a maid, making a little money, selling things to other people too, and healing a little bit. Her kid gets worse and worse. He's not obeying her. He's not diagnosed with ADHD. They put him on SSI. He starts, as he gets a little older, using pot, and she goes to school and she's just in tears. All depressed. My life's falling apart. They sent her to me. Not only is she in tears, she's hearing voices telling her, you're no good, you're a terrible mother, you're horrible. But she's actually heard voices of spirits her whole life. I'm doing this interview in Spanish. And I said, ask her, are the voices a blessing or a curse? It translates it, are they malo or bueno? Now, I don't know that much Spanish, but I know those aren't the words for blessing and curse. That just means good and bad. I said, no, translate it the way I said, blessing or curse. He said that they're a blessing, but my life has fallen apart so much that the demons have gotten in where God used to be. I said, so you don't really want them all gone. You just want to be strengthened so that you can use them like you used to. By the way, DCFS came by and threatened to take away her kid if she didn't stop practicing witchcraft like this. So she had to stop doing that, losing that role and all her money on that too. With time we met her, her self-identity as a wife, as a mother, as a healer, were all gone. Her relationship, she's isolated, her kid won't pay attention, no one else is around, and she's starting to hear more and more voices. We try to help with all three dimensions. Here's some antidepressant, here's a little bit of, it's like, but not too much so you can still hear God. Let's help you feel like better as a mom, get you in a mom's group and thing. Let's get you back to being able to heal other people. And let's have your other people to be with relationships, all three to pull it together. Second story. This is David. David was in a conservative family in the South, but they sent him to a liberal arts college where he learned all kinds of things, including like his family was racist and that hated his conservative values and liberal and stuff. But also while he's there studying all kinds of liberal stuff, he uses some LSD. That also turns out to be the night of the greatest sex of his entire life. And he couldn't explain exactly what happened, but somehow by the end of this night, he's running across the college quad naked, trying to find this woman wanting to marry her. This leads to him being thrown in the hospital by the campus police. His dad is so pissed off. I'm not spending all this money to send you to use drugs and this stuff. He cuts him off entirely. And the school is all pissed off. You know, we can't have people doing this. They cut him off too. In the hospital, he doesn't get better in just a couple of days from the LSD. Even in a couple of weeks on antipsychotics, he's still struggling along. When they let him out, he now has no life, is distant from his folks, lost his college career. The girl, of course, doesn't want him. And he's very confused. So he comes to California, where we have even more drugs and even less structure for him. Bounces around, walks into a yoga studio saying he's Paul McCartney, gets thrown in jail, steals things, on the streets, won't take any medicines, and gets more and more down and down. The only thing I could find left of his self-identity was he wanted to make sure he was a good father and didn't abandon his kids the way his father had just done to him. Being a good father was super important to him. So that's where I hung everything on. So you got to get yourself together to be able to make some money in a place to attract a woman to do this so that you can get there. You're not getting this dream by wandering around like this. Took a long time of rebuilding. Third story. This is Dr. Christina Page. She actually is, and that isn't her picture, but she's actually a real person. She also had weird ideas when she was a kid, thought she could see dead relatives and stuff, and her grandmother agreed. Her grandmother said, of course, that was your old aunt Emma, and that was your grandmother, and that's what they were. Yeah, they were like that. And of course, you can see dead people around. She became a physician because everyone in her family was a physician, but she became an intuitive physician because she could like tell what was wrong with people just by the vibes they let off. She became very popular doing this and left traditional medicine, started teaching more and more of this. I met her when she was at a mind-body workshop talking about intuitive understandings. And I even did a week-long thing with her in Sedona, paid her a bunch of money to teach me how to be more intuitive. She's got websites and stuff. And when you get to know her, she actually believes that she's not from this planet, that she is a spirit that came from another planet to help humans evolve and move forward. So we were supposed to, by 2012, to get to the next era. And by the way, lest you think this is so strange, we didn't get it done in 2012, and haven't things done really crappy since then? The world has gone incredibly downhill in the last 10 years since then. No one would call her psychotic even with all these strange beliefs, because she's got a family, she's got an identity, she makes a lot of money, people respect her, she makes sense. Her whole career, nothing else has fallen apart. In fact, she's been incredibly good at making meaning of her unusual reality experiences, of making an identity out of it. She looks at horoscopes and pays it into what all the planets are doing in weird ways, but she is able to hold it together, and no one would call her psychotic as a result. It's all three crumbling. So if you look at all three, and now we try to break it down, like with the cancer, where did it start? There's 8 different routes. I'm not going to go through all these routes. These are all different chapters in the book if you want to know, but I want to say a couple things about them. One is, every one of these routes has emotional difficulties to getting on. It's hard to deal with people who are using drugs. It's hard to deal with people with serious childhood trauma. It's hard to deal with people who aren't making sense. It's hard to deal with people in incredible grief. Each one is a different emotional challenge. You need emotional preparation and emotional luggage to take these trips. By the way, so the first one, loss and grief. When someone dies close to you, half of everybody has a psychotic symptom. You think you saw the person around, you heard their voice, they came and told you things, you got signs in your dreams, they reappeared, you had this weird sense of time, things didn't quite feel real, you couldn't function very well. These are perfectly normal. About half of everybody gets psychotic after terrible loss and grief. Why does it usually turn out okay? Because we're not frightened of it. We don't disconnect from people when they're grieving. We can understand what's going on because we've been through it. And we're hopeful we know it'll get better. We have all these structures for help you go through this tough time. We bring casseroles over, explanations, we say comforting things, we share stories, we let them go through grief, and the vast majority get better all the time. If we could give that same level of understanding and ritual and connectedness to almost everyone they first started showing psychotic symptoms, a huge number would recover. In fact, this is being done in rural Finland by the open dialogue people for 20 or 30 years. Every time someone has a break, they do these rituals, coming together as these groups together. Everybody knows the person. How do we keep this person together? What kind of support they need? Rarely do they need to go to the hospital. Rarely they need meds, and 80% are out of it without ever needing meds in 6 months. We do that all the time. We agree. We just don't do it for the other ones. All right, let's move on to improving services and outcomes. We got a way of putting people together and understanding how can we use that to improve what we're doing. We can integrate these 3 levels in every stage along the way. We can talk about prevention. How do we prevent people from losing their way in their self-identity? I see this all the time in our college. How do we prevent people from getting isolated? How do we prevent people from losing track of reality? All 3. Early intervention could be at all 3. Our crisis response can be all 3, and our recovery can be at all 3. So let me give examples here, and I won't go through the whole set, we don't have time, but in the first column here, I have our standard medical model services, which are probably well known to you guys. It goes through the whole spectrum that are all directed toward the experiencing reality dimension. The next one is a recovery model that talks about the self-identity and relationship dimension. So I'll do a few of these fast to give you a flavor of this. So you guys probably know mental health first aid. This is the most common nationwide mental health education thing. It teaches you there's symptoms of an illness. Mental health is an illness just like any other kind of illness. Don't feel stigmatized by it. Go find a professional, get the treatment you need. Emotional CPR was made up by Dan Fisher and some others that said, no, this is an emotional tragedy you've gone through. Let me help be a good friend and give you the space to connect so you can start to feel more empowered and come to your own solutions and pull it together when you're young. We don't have professionals that everybody can go to. Could we all be good at being great friends and connecting like this? The prevention ones, in LA, we have something called peer, which is you find people even before they're psychotic, make sure they get some meds early so they don't get all the way to psychosis. Headspace is in Australia, is in shopping malls for young people to hang out and learn how to do relationships and find themselves without any real connection to illnesses, so they don't get lost in the first place. I already described the two first break programs, the one with the military that took you out, made sure you made meds, and the one that had everybody hang out and give you support. Intensive support, ACT teams is like a hospital without walls, takes care of things for you. Full service partnerships is the recovery version of this that we've pioneered at the Village. You make partnerships, work on their goals, engage with them when they take meds or not, rebuild their lives and identities, give them roles. Crisis response, these fearful police-driven urgent care emergency rooms in voluntary coercive stuff, versus soteria was invented by the people who used to spend a lot of time with drug addicts and said, if we can hang out with someone really messed up on LSD and on stuff like that, maybe we can hang out with people who are messed up with psychosis. And their results were over 6 months getting just as many people together as the hospital did. Those results were so controversial, it was sort of banned by the medical system, and Mosher, who ran it, was kicked out of running NAMH. Here, respite programs go into this. Recovery, the SAMHSA version is learn that you have an illness, learn how to what the symptoms are, learn how to take care of itself, to be able to manage this as a chronic illness model. Recovery can be about Clubhouses, a place where you find meaning and roles. It's absurd that there aren't 40 Clubhouses in Los Angeles County, scattered for people to belong to and connect to everywhere. Voice Hearers is a group where you say the voices have meaning. Let's understand them, especially do they have traumatic roots? How am I going to deal with them? How am I going to talk to them? How am I going to incorporate them part of my life, rather than trying to be in a battle with them and trying to erase them? And RAP plans are a self-help technique for what's your personal medicine, what helps you to be able to get together. Is it friends? Is it rest? Is it staying away from drugs? Is it using your medicine? Is it going on vacations? What do you need to do at various levels to be okay? All right. This is the pic. I could have done this with the pictures. Here's Headspace. Here's Raise an Open Dialogue. Crisis response. I want to spend 1 minute on prescribing, just because I'm a psychiatrist along the way. The standard prescribing way of doing things is you see the person, you take a history, you make a diagnosis. With the diagnosis, you identify some target symptoms, you prescribe some medication or other treatment. You give informed consent so they understand what you're doing and they can make some choices between a few if you've got a few choices. When they come back, you check how well did, assuming they do come back, you check how well did they do to the symptoms, lower, do they have any side effects? You try to alter the meds from there, maybe teach them and their family some about the meds they're using and the other treatments. If they start doing well enough, you can add some rehabilitation to build some function to return to life. That's the standard medical model that virtually everybody uses and everybody's taught. It has very little to do with your self-identity or relationship parts. Here's a recovery-based prescribing method. When I first come, the first step is not a diagnostic interrogation. The first step is getting them to like me, connecting, engaging, making a trusting relationship. The guy I mentioned who I saw last week who, when the girl wouldn't date him and he got all messed up psychotic, first thing I did was tell him about how messed up I got in college when a girl wouldn't date me either, and I almost didn't get into medical school because my grades dropped that semester. Get them to like and connect with me and think we're fellow people, we have a relationship. Second step is find out what their goals are. What do they want? And build hope so that they can believe it. When I know what their goals are and what they want, then they have a chance of being motivated for what they want to do, not what I want them to do. From that, I create a shared story of their lives. Every time when I see someone and I get the whole story of their life, both the positives and the negatives. Then when I write it down, the second time I see it, I read it back to them. You ever met a doctor who read back their notes to the patient? I read back the assessment, which forces me to write it in a respectful way that they can recognize as their own story, using their words and their perceptions. I don't accuse them of a variety of clinical things that, no, you're broken down with a large breakup and losing, feeling fragmented as a result. This is good mirroring to help them make sense of what's going on. Then we work together to see how you can get things better to achieve your own goals, and often work medications into that. Not necessarily I'm treating an illness, sometimes using meds to help with being less fragmented, or help you have more rational control, or so your nightmares don't explode, or so your thoughts aren't going round and round in your head, or you have more motivation. Then as you start changing as you're taking meds, and your reality changes, the voices go down, how is that going to change your own self-image? How are you going to adjust to this different? Isn't this weird that you took this meds? And what happened? When they first gave long-acting shots forcefully to people in England, a bunch of them killed themselves because they couldn't adjust to what the hell happened to my voices. And have I been crazy all this time? And then help them put together the meaning of the changes so they can sustain them over the long term. Trying to say, oh, you're stable, move on. Notice how I'm using my time with someone to change their self-image and relationships. Last one is a shout out to you guys, to families in particular, if you're trying to look at those other two dimensions. Trying to maintain your normal relationship as much as possible. Us as professionals, we're trying to turn you guys into miniature caseworkers and doctors in your own households as much as possible. It's okay to be an overprotective, worrying mom. That's what moms are supposed to do. It's okay to get into fights over your independence or your grand, what are you doing? It's okay for a dad to be picking on, how come you're not being more productive? Get out there, and dads are supposed to do. For brothers or sisters to be jealous or resent the time being spent on that person instead of them, or getting into fights. Instead of it turns all around, the family becomes a treatment environment. Try to keep as many normal growth-oriented relationships as possible. Try as much as possible to encourage other relationships with people so they're not stuck with just you all. Can some of those friends be kept around? Can some girlfriends or romantic stuff? Is there mentors, people who've been through this before who connect them, maybe coworkers to stay? Focusing heavily on their development and maturation, trying to restart it or sustain whatever is going forwards from, even if they've lost 20 years along the way. Pursuing their life goals, what be growth goals instead of pursuing illness goals. And trying as much as possible to minimize coercion and caretaking. Some risks are necessary to grow. You can't be risk-free and grow, but they don't have to take risks alone, and you don't have to experience the consequences alone. One of my favorite NAMIs I've ever been to, I went to one of their awards and was up at Davis, outside of Sacramento. It was a really unusual, it was a NAMI of mostly like college professors and stuff who were there. And their kids were actually in college, many of them doing well. It wasn't this group of people who are like an IMD is doing poorly. And that NAMI acted kind of like a PTA at their clinic. They ran a bicycle ride thing and talked about how to repair bicycles, and Davis bicycle riding is a big thing. They ran these groups, they did these art classes, a hiking club, job interviews, all stuff that the clinical staff was never going to get around to do with. They did a little bit about what's the biology, but they were far more concerned with what part of life can I bring to things, to enrich these lives, to bring things, because most people end up with very, very narrow, impoverished lives. How can I make life come to this clinic? One of the things, if you went to the village in our heyday, is it was always full of life, very dramatic, lots of laughing and things going on. It didn't feel gray and dull like the average clinic, because there were people doing all kinds of stuff that had nothing to do with illnesses. And this NAMI had family, bring whatever your strengths are and all kinds of other things. They're doing like making little films with people, all kinds of things, whatever you happen to be good at. I love Clubhouses as a place, not just to find roles or work or things to do, but a place to have some safety away from your family where you can start healing and finding yourself grow and find other people with voices, learn how to date while you're hearing voices or while you're paranoid, learn how to put up with the side effects of meds and other people going around. It's not anti-meds Clubhouse. It's a place to be together and grow together. It's a shame we have so few in Los Angeles. That's the end of my prepared remarks. You can find the book on Amazon or Kindle. It's cheaper on Kindle and I make more money, but whichever one you prefer. I get a whole grand $6 on that, $2 in the paperback. And you can find articles on the website. And I actually am still doing training scattered around for different groups. I'm doing a training for Orange County staff on Monday, I think, and going up to Washington State. And for some Rutgers, I'm doing a video training on medications for people with dual diagnosis, substance abuse and mental health, different things. So I do different trainings for groups too. All right, you guys have been listening to me a long time. Let's see if anyone's still there. Let's stop the share and look at the group and how people speak up, either hopefully just by speaking up, by unmuting yourselves or by chatting or saying stuff.
Why don't you, so we can see you and raise you, and let's see a hand raised in your box, and I will call on you and you can ask your question to Mark.
Look at that. She wants some order and organization to this. Go for it, Sharon.
I can't see anybody here. Not anybody. So, yes, Mitch.
Good, Mitch. I can't, you're muted, Mitch.
I think you must be muted. We can't hear you.
Sorry, you were talking about some of the patients not taking their meds. Don't you find that oftentimes it's that they have a lack of insight? Why would they take any antipsychotics if they're normal? And my second part is are you successful at all in gaining insight into these patients? Is there any techniques you do or your rapport?
All right, so first, define what you mean by insight.
Well, insight would be recognition that they have mental illness, and thus why would they take it?
All right, so insight means that they believe that there is a biological cause for what's going on with them.
Correct.
Now, by that definition, no one had insight before 1950. Because people didn't usually think it was biological. I thought, so the people who think it's a spiritual condition, or the people who think it's a traumatic condition, or the people who think it's I lost my mind, or a psychodynamic thing, or a whole variety of things, the only whole thing on that menu, those 8 choices, that we're willing to offer them is you must think it's a mental illness. You must think it's in that box. If you don't have insight.
Right.
So let's start out with, it's possible we could come up with an explanation from another pathway that we could both agree on, that we could make sense of. Because less than half of people are going to believe that it's a biological illness. That pathway dead ends rather rapidly. But most of them will think there's something going on, something wrong. I'm different in some ways. I was never the same as other people. Something going on. I'm under persecution. I'm under stress. Things are exploding in a variety of ways. So the first thing is just try to I asked them, so before you met any doctors and mental health people, what did you think was going on? What does it look like to you? Rather than trying to sell them my biology, what do you think is going on?
Well, can I just say, my son would say that he has a pock mark on his forehead that he got from chicken pox when he was 11, and that causes him not to be able to see. It's body dysmorphia. And for the last 11 years, he's convinced it's not in his brain, that this little pock mark that he's seen 11 dermatologists and got all these skin abrasion therapies for, that it's still there and it affects his vision. And I can't convince him that skin on his forehead has nothing to do with his eye. And so what can he convince you that it does? How does the skin affect his eye? How's that work? Well, he believes that it gives pressure to his eyeball. So the skin puts pressure on your eyeball, and then what happens? How does that affect your eyeball, that pressure? How does that work? he hasn't quite explained that, but it's also the reason why he can't have relationships with other people, because it's so abhorrent, this little teeny mark that you can't even see.
So
So-
he looks so disfigured that no one would want to have a relationship with him.
Correct, even though I can't see anything.
What he sees. So
Right.
let me do a quick story for this, because this is a crucial piece. We get into this business of whose vision of reality.
Right.
A guy walk. I don't know if you can see me well enough in the little squares, but a guy walks up in my office one day. This is a true story. He holds up his hand like this. He says, "What do you see?" I said, "I see your hand." He says, No, be more specific." I said, "Okay, I can see the swirls of your fingerprints. Everyone's different. I can see the creases between your knuckles, and I can see your love line and your lifeline. I don't know which one's which, but I can see them." He says, "When you can start seeing nails and knuckles and hair, then you will be able to start helping me, because you'll be seeing the world from my side instead of from
Wow.
yours."
Wow, wow.
So
Yeah.
with your, I'm not, my first hours with your son would not be trying to convince him of anything. It'd be trying to understand how his vision of his life works. And I might fit some things in as it goes along. For instance, when my kids were little in school, this guy came to the school, and we had him as a speaker, as an inspirational speaker. And he was a comedian who had a giant hemangioma tumor that covered about half of his face. And he was there with this weird tumor on his face. And he's talking to the kids, and he's a comedian. But he's not telling jokes about his face and this tumor. He's telling jokes about going to Catholic school and the nuns and the stuff going on, and trying to get the girls to like him and stuff. And there's all these things going on. And the weirdest thing is, the more he talked like that, the tumor started disappearing, and you started seeing the person instead. You started relating to him and liking him and seeing him as a regular person. And by the end, his punchline was, "If I could get a wife and a date with this face, you're going to worry about the pimple on your face?"
Well,
So I would begin with things that go with, all right, so you feel so deformed, no one be with you. Let me show you a YouTube video of someone who's deformed who managed to make sense. But that's an example of starting with his view of things.
Thank you. Thank you so much, Mark. Thank you. Ben Coonan has his hand up, and then Cynthia and Garrett. So Ben, I can't see you, but I see your hand is up.
In
Okay.
a black square.
Can you hear me? I'm not sure how to make my picture come on. You can hear me okay?
We
Yeah,
can
we
hear
can
you.
hear you.
Great. Okay, so my son is in Orange County, and he's at a little sober living place. You mentioned you were going to do some training in Orange County, and I would love for him to have anything that has your approach with it. So my main first question is just simply, what's the group you're going to be training, or are there other groups in Orange County that we could? He's pretty much refusing services, but he needs help, but he doesn't, he wants help, but he doesn't want services,
So a couple of, in this environment, these are Zoom trainings. It's for the Health Care Authority of Orange County. They're actually
Okay.
taping them. There's a series, about 4 or 5 of them now.
Okay.
Along the way. This one this week is about crisis services, or this one about crisis services. They're designed for staff primarily, but actually there's one about psychosis. It was sort of what I just shared with you guys, was the one last month. For him though, learning more, would it say an approach? What do you think he would like about my approach?
Well, if I talk to him, he's like, he wants a different place to live. He'd like to hang out with people. But he kind of, as far as your approach goes, what I like about it is that you're willing to listen to him. And since I've been looking at your book, I've tried harder to just listen, try to get them to open up and talk. I'm not necessarily good at integrating much into it other than just trying not to react and just trying to create trust is what I've basically been trying to do.
Mhm. So by the way, you asked about trainings a minute ago. If you, just for your side, if you want to get better at that, you might, it's not nearly as easy as I make it. I remember doing 2 days worth of training on listening, just that one thing, which by the way, is what NAMI group said they want professionals to have more training on, is listening. But
Right.
you might look for emotional CPR trainings. The one that I mentioned that Dan Fisher does is about how to connect to someone and help them have the space to be empowered to come up with their own things. It comes from stuff about trauma, people, help like 9/11 and things like that, and peer support things as well. So if someone can feel a reasonably safe, which isn't the easiest thing, they might be able to say something about, all right, my goals is to have a better place to live and some more friends. And when you try to do that, why do you think it's not happening? What's from your point of view is getting in the way? And what do you think your son would say to that?
I think his general feeling would be that somebody hasn't made it happen for him as far as how he would express that. I'm not sure. Can I just mention, I had a conversation with him the other day. He gets in the car with me. He says, "Oh, I think there's something wrong with my blood because I'm hungry so much." And I said to him, oh, I said, I kind of know, from talking to you, you're not really comfortable with doctors a lot, because I wanted to find out what his feeling was about that. And he talked a lot, which was interesting. And, but he sort of basically was saying they didn't know how to do the right thing. In his mind, he knows what's best for him, and nobody else really knows how to treat him properly. So that was the gist of it. But then he kept on talking, well, here's a guy that almost, he almost dissipates into the woodwork. He doesn't communicate much. And then he started talking almost like he was trying to create a rap or had a stream of consciousness. So I loved that all this was coming out of him, and I could see here's so much intelligence in this kid, but he's 33. But at the same time, the direction it's going is maybe in different directions, but that he's so quiet, I could understand where he probably feels a lot of people don't respect him properly because he's smart, but since he never communicates hardly, they don't know what to think. They can't understand what's going on in his head because he's not sharing it with anybody. Anyway, I just wanted to share that because that was kind of
so let me give a little bit of feedback about that particular thing, because it goes to your thing about listening. For one thing, maybe your efforts to listening are working. He's talking more.
Absolutely. Yeah, that was what I liked.
There's an old saying, I think it was Mark Twain, that said, listening doesn't just mean waiting for your turn to talk. So if you're listening, one of the things, especially for people who are that kind of stream of consciousness or weird associations are hard to put together, listen for the music instead of the words.
Okay.
Let it kind of flow over you. You don't have to put everything to sense it around, and see what kind of senses you get, what kind of emotions you get from things, what kind of sense, then trust your own intuition a little bit, the part of you that's kind of not very rational. Don't try to put it together in perfect rational. So say, let's go together. And you can, from time to time, and back to my respectful curiosity, give feedback. I said, say, what popped in my head while you were saying that is how when you're quiet, people think there's nothing going on in your head.
Mm-hmm. Yeah.
You to give back something that's sort of coherent. And if you do it in a way that's real different than saying you lack insight, you got to do it my way. It's to see what comes. When you're right, you'll get more stuff back. When you get wrong, it'll go back to the same stuff, trying to explain it to you again, or
Thank
shut
you,
down
Mark.
if you did it really wrong.
Thank you,
That was
Mark.
fantastic.
Brilliant.
I
Thank
loved
you.
it.
So I'm going to move along and call on some other people because we have limited
You don't want to
time.
be here till midnight, Sharon?
Well, Cynthia and
Oh,
Garrett.
man. Thank you.
Sorry, Bill, we have to move on.
Yeah.
Cynthia and Garrett.
Hi, Dr. Ragins. First,
Hi,
let me
Cynthia.
tell you, I loved your book. 625 pages of pleasure of reading. It's like reading a support group with all these different real life situations.
Write that down in a review in Amazon so I can sell some more copies.
Okay, I might do that then. I'm writing down a note. I've been hospitalized about 26 times. The good news is I've been out of the hospital for about 14 years.
Oh, very cool.
I have a master's in clinical psychology from Antioch. I'm working as an intern, and I've gone down from 550 milligrams of clozapine to 350. So there's a lot of connection and meaning, and I have a beautiful, beautiful life. However, I still sleep 10 to 12 hours a night, and I can only work every other day because it takes so much energy out of me that I have to work every other day and take Tuesdays and Thursdays and the weekends off. I also struggle with sleep apnea to the point where if I don't wear my sleep apnea mask, because I've gained so much weight, about 40 pounds, then I'm gagging at night and it's hard to sleep. So I have a good life. I don't want to come. I'm very grateful and I love your book. And I wonder if you have any tips for somebody that's on 350 clozapine and working really, really hard to give back to society.
So thank you for sharing all that personal material for a group like this, because there's maybe someone else who remember the stories as well. I assume clozapine was how you stopped going to the hospitals and got it together is why you're not tossing it out the window, because you know you want your life to stay together with this.
Exactly. I have a good life.
Yeah.
If I can get a little bit more energy and take more advantage of my day and work a 9 to 5 and be independent, it would bring a lot of joy to my heart. And I just want to say, in my support groups, I do support groups currently, and I did it for NAMI. In the support groups, I tell the people, you can have a mental health condition, but you can still come from your heart. And I'm a big believer that when you get into the person's heart, then there's a lot of healing that goes on, and listening and hearing the person from a heart-centered place. And I don't know much of the science, but I have been learning that there's a kind of a brain inside of the heart that they're finding now.
Mind.
There's a mind in the brain. There's a mind in the heart.
Yes.
And I love coming from my heart, and I love witnessing when other people come from their heart. So that's something that I've learned.
So a few comments there. And actually, I'll do a story to see if I can connect here. So you seemed, unlike First Man's Son, seem to be reasonably okay with a medical model and illness and take pills to go with it. That journey is working for you. This isn't like nobody can go on that journey. That's fine. So let me tell you a story about a lady on a similar journey that may help you both. So her name is Rachel Remen. I met her in her 60s. She's about 80 now. And there was like 12 doctors in her family, so she knew she had to become a doctor growing up. But she had Crohn's disease, which is this terrible inflammatory disease of your bowels that can make you weak and in pain, inflamming, diarrhea, and losing and nutrition, all these problems. Hers was so terrible, she had like 12 surgeries in her teens, removing bits of inflamed bowels and all this stuff.
Jesus.
So by the time she makes it to medical school, she's been a patient way more than she's been a doctor. And all those inhumane things that the doctors do walking around with the medical students on rounds bug the shit out of her because she's seen it all from the other side.
Exactly.
And what she realizes, she says, you know what? The average patient does not need, despite Sharon's introduction style, does not need a perfect doctor who knows everything and is compassionate and saintly and that's got all their act together, do all this stuff, and knows all the answers. They need somebody who can be compassionate and connect with you through your heart.
Exactly.
And she developed something called being a wounded healer, because most of the time, the source of your compassion is going to be your own wounds.
Wow.
So she goes on, and she's still ill. She was terribly tired when I saw her doing presentations. She wrote a book called Kitchen Table Wisdom.
Oh, we have the book.
You have that book, right? Kitchen Table Wisdom. maybe you know this story. So she actually was one of those MacArthur Grant Genius Award people. And what she spent her time doing is she would do these 2-week retreats. Some of them were for patients when they were first diagnosed with cancer, before they did any medical things, to come to some kind of terms of the meaning of this for them. What's it going to do with them personally, their identity, their relationships, their money, their spirituality, the rest of God. Before we start with all this big stuff, let's just sit quietly and reflect. You're not going to die in 2 weeks, probably. Let's sit and try to get some handle on this, what it means for you as a person, not what it means for you as a diagnosis. Which would be really interesting to have 2-week retreats for people in their first diagnosis of psychosis. For people, what does this mean for you? And let's put it together in different ways to come to terms before we handed out any pills.
Right.
Rather than start with the police and an over medicated in the ER.
Right.
The other thing she did was she ran these 2-week retreats for doctors who were burned out and didn't think they were healing anymore, who had lost their heart, why they were doing this in the first place, along the way connecting. Now, she was very valuable in this stuff, wrote this book that went into trainings, but she still has terrible Crohn's disease, and she has to make huge accommodations for this condition. She too can work about 4 hours a day. She needs extra rest. She has the thing, she has to worry about nutrition all the time. She has to do these things to make accommodations to live as full of a life, accommodate both to her treatment. Because she actually, I haven't seen her lately. She's probably on immunosuppressions that make her more likely to get COVID too. Like a whole set of other things that come from the meds that they're using for this too. So that's my picture for you overall. The last piece I want to say about this is, and you probably know this already, is both Patricia Deegan and Marianne Copeland have products that are about personal medicine and taking care of yourself. That go be, all right, I'm not going to get more energy just by lowering the dose or adding a stimulant or adding some Wellbutrin to this. That might work or might not. Try shit like that. But beyond that, what else energizes me in life? Just having a puppy that bounces all over the place and makes me go for walks energizes me in life. Just chasing women energizes me in life. What gives me, that's what worked for Picasso. What makes things do for me all across the board for these same goals? When you move it out of just being even if you're using an illness journey, that doesn't mean you can't bring in things from other parts of life to deal with these things about what can I do about weight, what can I do about sluggishness, what can I do about energy. And you may well have to make a bunch of accommodations for both your condition and the treatment for it. But there may be other things you can get hold of that aren't strictly within a medical model to do it.
That's very good.
Thank you
know,
for that information. And I just want to say I'm blessed every day when I go to work because I love what I do. And I have a beautiful support network with NAMI Westside Los Angeles. And I'm on a journey. My life is taking some beautiful turns.
And I
Very
just want
cool.
to say one of my favorite books, Mark, is Naomi's book, Kitchen Table Wisdom. I mean, it's just so full of hope, the stories of courage and hope.
I'd especially say anyone who is trying to become a mental health professional that's connected to their own wounds of themselves, whether it's childhood trauma or they saw their family going through something or they've been through conditions or stuff. If your wounds are connected to your gifts, it's worth looking at yourself as a wounded healer.
Yes.
That's what you're trying to get. She's a great model of that. All right, I think we have one more. Do we got
We
Sharon?
have two more questions.
Two more. All right,
Donna
what do we
Lee
got?
and Angela, and that will be it. Dana? Dana, can you hear me? Dana?
Yes, I can hear you.
Okay, all right.
Oh, did you call on me? I'm sorry.
Yes, your
Um,
hand is up.
And thank
It's
you
been
for
up for
calling on
45
me.
minutes.
I was just wondering, I'm also where, that was Stephen's, my son's father, who you talked to at first.
Okay.
And I have to honestly say, your book really turned our family around. Seriously, where we became much more on the same page, and I'm very grateful. The first 3-4 pages changed my whole attitude about my son's illness. And really, I thought I was empathetic. I did not have a clue till I read those first 3-4 stories that you had to share. I'm wondering, is there some doctor in Orange County, because my son is in Orange County now, and AOT is trying to get him to accept services. He did get this illness as a result of severe TBIs, that he had multiple ones. And off his medication, he's regressing on an age level severely. And he has catatonia to a degree. And as Ben was saying, he was astonished at the conversation. My son usually says one word answers, or at times has literally growled at me. So that's where we're kind of at, and that's why that's just so amazing for him. I'm wondering if we can even get him to go to a doctor. Is there anyone who you would recommend in that area or anything like that?
I unfortunately I don't, especially because I mean, because I mean, as you know, there's so few doctors doing this kind of thing. We're isolated, and I haven't been in this kind of environment for a while. You probably have tried this already. As far as I understand, the lone surviving clubhouse down in Orange County is the one that MHA Orange County runs, although they're being harassed by the mayor and stuff. You might ask their staff who they like the most, or the people who come to that clubhouse who they trust.
Okay.
Or other little, because it's like anything else, almost anything else, we look for customer rec, you know, what plumber did you like? Except with mental illness, we tend not to trust the customers themselves. I say it is a way to find, you know, is there some doctor these people like a fair bit, or to go to groups and speak highly of them, where they find along the way? Because if other people with similar struggles like them, that's a I mean, it's a good, using them as a good reference. But unfortunately, I don't have a clear answer to this. I'm not.
Well, I'm sure my ex-husband and I had never even heard of the lone surviving clubhouse.
Well, that's not the name of it.
Or something. That's not the name of it?
No, it's look for MHA in Orange County, and I don't know what the name of the clubhouse is actually. But if I'm sure you can find a website, MHA Orange County, and then that'll be listed as one of the things they're running.
All right, great.
I think a lot of people there are homeless who go there.
Well, my son is just one step away from homeless, because I'm the one I'm supplementing him, and his attitude is he doesn't have what he wants because I'm not willing to pay for it. Which is what Ben was very nice.
Right, what he was saying about how you're going to be someone else left. So a couple of things just common. First, thank you so much for the thanks. That was so moving and heartfelt. Your first few minutes there, you don't get my glib response of once you put that on the Amazon website, because
I meant it sincerely.
But I could feel it even across the screen, and that's very touching to me on the other side. That a couple good comments about this. One is, you talk about going developmentally up and down, and that does happen with people who progress up and down. And you may remember the part where I talked about the 4 stages of the one is you don't know what your own needs are and you need to take care of. The one is you're just self-centered yourself and you think you can take care of it. The next one, you connect to other people with love, and the next one is kind of a spiritual level. You may well move up and down at different ones, and the way you connect is at the level he's at. If you expect him to be at a higher level he's at rather than when he's at. So if he's at when he gets really regressed, probably you as a mom who wants to do things for him and put it into that is the way to correct a kid who can't take care of themselves, sort of thing. Whereas with this time, well, I wanted to do some stuff, then taken care of isn't necessarily the best way to get to that level, but to try to match you where you're at, where he happens to be. And it might go up and down at different times and different approaches. Something that's right, you know, you raised him when he was little too, you know, that what worked at one age didn't the next year, or the different one, what worked with one brother doesn't work with the sister, that you keep moving around like that. So one thing is about connecting developmentally like that. But I had one other thing I was going to say about what you said. I lost what it was.
We have one last question.
Yeah, let's do the last question anyway. Let's do that. Yeah.
Angela, I see your hands up.
Well, thank you.
You're kind of in the dark. We can't.
Thank
see
you so much, Dana. I appreciate it.
Dr. Ragins, welcome to the club of people over 50 who can't remember the next thing they were about to say. This happens to me daily. And
Yeah.
luckily, I am surrounded by young people, millennials, who are always reminding me and going back and telling me what I.
You know, I am now the oldest person where I work, and that doesn't make me feel younger.
But they're great to work with, aren't they? I
Yeah.
have to say, I really don't have so much of a question, except that I would like to consult with you at some point about what I've done here. I put together a house for men who are med compliant. It's in Rolling Hills, which is not too far from Long Beach. And I did start to read your book, left it on a plane, and then haven't replaced it. So mea culpa, right? I'm onto something else already. I'm a little ADD about that. You know?
Another advantage of the Kindle one, you can just download it
Yes.
again.
Indeed. So, you know, I just wanted to, this is just a shout out to parents out there. I will say that I have put together something that's working. I perceive it as working pretty damn well. The guys all get along great. That's not the problem. The problem is finding reliable staff. Otherwise, I have a house that I'm basically here as the mom. I give a crap. I care that these guys are doing something that is meaningful to them, that they get square meals every day, that everything's healthy, done well, they get their meds. I'm having a hard time finding other people who I can hire who are not parents, who want to have the same level of care and compassion for these individuals that I do. I'm finding a lot of very flaky staff people who want to be this house manager. Otherwise, I have great peer support. They're amazing. The guys are doing well. And I just want to tell parents out there, I started this house and you can do it too. And we have mentally ill guys who are med compliant and they all get along great. My worst nightmare was that they wouldn't get along. And that is not the problem. They all get along great. They're all very good friends. The more we do things together and they all go along well and become good supports for each other, which is happening, they're all improving. One's got a job offer, one's getting a job, one's already working on his own YouTube website. They're all doing amazingly. That's not the issue. The issue is finding one person who can replace me, or maybe even a couple people who can replace me. That's what I want to talk to you about, Dr. Reagan, at some other point.
Yeah, well, let me give a little feedback and answer your question. So there's, I think, two things about staff. One is you're looking back to that business of the barriers. You're looking for staff who can move beyond fear, incomprehensibility, hopelessness, and disconnection. Who actually want to do those things on my compass thing there. Two places to look for them. One is a big place, is psychology remains the most popular major at my Cal State Long Beach in most colleges, even though you can't get a reasonable job with a bachelor's at it. There's a whole bunch of people every year getting bachelors of psychology that have personal experience and have hearts that want to go into this and have crappy job prospects. You can look for them in the colleges, look for who's showing up at the various mental health advocacy things there, who's showing up at the Healthy Minds group, who's showing up at the JED Foundation things, who's showing up in their colleges things. We have like beach buddies of people being peer supporters, did a year in our counseling center, which some people want a part-time job or a full-time job doing this sort of thing. Is one place to look for people. The second, even more focused one is Mental Health America of Los Angeles, I believe is still doing this, was running something called Jumpstart, which would take people with a bachelor's degree in some liberal arts that's useless and has no job prospects, and do about a 6 or 8 week training program that included an internship placed in one of the mental health programs, learning recovery model, learning how to do things, and then they try to place them in jobs. You could see if Jumpstart is a place to find people as well. So that's one of my things, where to look and what you're looking for. The other thing I want to say is about how to treat staff. And I have no idea how you're treating staff, so this isn't a criticism one way or another, is that for staff to treat the clients as whole people, we have to treat the staff as whole people. Whether they're a psychiatrist or a house director, what's your staff's interest? What personal things do they bring? What gives them hope? What empowers them with self-responsibility? There's a director at the mental health center in Denver, big place, multiple site. Every new employee he gets, he says, come on in, I want to know who I just got. What makes you special? What are your gifts? What are your dreams? What are your hopes for your life? How can I help you grow? How can I, you won't be able to, what can I help you grow either within our agency or outside of our agency? What are your goals? What makes you unique? Everyone, you're not just a widget. I just hired my 4th case manager this week. What's unusual about you? How can I use and stuff? Respecting and curious of their stories so that they're treated, you have to treat them in the way you want them to treat the clients. And very few mental health professionals are treated like that, let alone staff in residential places or
Yeah.
board and cares or stuff like that.
Another place she might look for staff is like the UCLA psychology department.
Well, that's what I'm saying. People who get
Yes,
bachelor's
Santa-
degree of
Santa
psychology,
Monica
who
says
aren't going to
no.
move on.
Yeah,
I'm actually fond. I mean, I'm fond of my school because it's a school of people with lots of talent and no privilege.
well, yeah, so your school
Like,
might have people that are really workers. Yes.
but
Right.
that's just my
So we
personal
have
bias.
one last
And
question.
we all know what that means with experience. Yeah, they're all.
Okay, Mark, we have a woman who's had
Okay,
her
we'll
hand
do one last and then we'll.
Okay, Laura.
We've had a
Laura.
good time though.
I'm here. I'm
Hi,
here.
Laura.
Thank you so much. Hi. Oh my God. You're making me think about how I'm a speech therapist. I'm a mother of a 20, my story. I am a mother of a son with autism, a 20-year-old, and a mom now that schizophrenia and bipolar, 29-year-old daughter. And I love the way you're saying about putting the story together. And I think in this last month, is putting that puzzle together for her and realizing what she has. It's an interesting journey. And I remember, even as a therapist myself, because I work in the autism world, it's all about relationships and connections. So I truly believe, and my question was going to be in the area of how do we do when we think, for many years, I thought my daughter was, and possibly was, in the autism spectrum as a woman, and because of the hypersexuality, that's where my question was going to lead to. How do we deal with this when we know women in the spectrum tend to be very hypersexual, but now it's becoming, she was hiding her hypomania so much, and now she has these psychotic events, and it's looking more as schizophrenia type and bipolar. I don't know. I'm disorganizing my
I'm
thoughts.
sorry.
Because I'm just
You
learning.
have 2 children. One who's autism. One who's become psychotic now. But the one with the one you were asking about with the sexual behaviors, that's the one with the autism, or that's the one that's becoming psychotic now?
The psychotic one. The 29, my 29-year-old daughter having the psychosis and
29.
29. Berkeley student, MIT grad school, and MIT was the bomb. That's where everything exploded. I think the stress and the competition and a lot of.
It's a stunning place
when you
like
talk
that.
about stages or how to view it, I'm thinking of biological. I'm thinking of TBI because she was a volleyball player, hitting her head so many times. I don't know. Coming as an autism mom as well, we just want to figure out where did all this come from.
Yeah.
So
Actually, part of me wants to answer this question. Part of me might ask you a different one, but let me try. So sex is a world of its own almost, and trying to tell a narrative of where did sex life come from. And moms may not be the best people to ask their daughters about how your sex life evolved either. That might not be, I mean, the best guide along the way. But what makes sex hard, amongst a lot of things, is that it has an amazing power and can overwhelm the rest of our brains, our rationale. We do some of the stupidest things behind sexual attraction or falling in love, or especially if the two are connected to each other. And we're likely to end up on all because it's incredibly powerful. And it's so one of my thoughts is she must have been a very ambitious person and very
Yes,
driven to have gotten all. You don't get to MIT without being really
yes.
driven and
She's summa
ambitious.
cum laude,
Right. You
Berkeley graduate.
also don't get there without a bunch of self-sacrifice about giving up things in order to do these things, or you don't go out on as many dates and get to MIT along the way usually. And it may be that this is some of her trying, and I don't know this, but this may be some of her. She still is probably a driven person underneath, but it's how do I restructure where I'm heading and what things are about. And sex may well feel like something that's still there, something that's alive, something she hasn't explored before, something she can get easily approval for and connect with other people, something that doesn't take the hours of studies that physics takes to be on, or whatever she was studying at MIT, to do these
Molecular
things.
biology. She worked for
Or,
Illumina. She
right.
worked for,
And
I think
and
she's
and many sex has a way of being easier. Of you can be successful, especially as a woman, you can be successful sexually with a lot less effort than all those other things you're describing. At
that
least
causes her
temporarily.
stress and anxiety, correct?
The what?
That causes her stress and anxiety to be performing at a level.
Well, or even just part of her that wants to be something. There's still the motivational part. It's not necessarily a bad thing to have. It's probably a good thing to have motivation and energy, but what kind of outlets and avenues? But also, she may well be substantially behind developmentally sexually if she spent all of her time in these high-powered schools that aren't so, party-oriented or whatever. I can speak with some experience since I went to Caltech as my college, which is kind of similar to MIT. So that may be that she may be at a sexual stage more like an average 14 or 15-year-old, and being that kind of out there sort of things. It may help you to look at it instead of looking for the biology, the TBI, the explanations. Look at a developmental point of view.
Got it.
What kind of experiences she has, where she's grown, what age, forget how old she actually is. What age is she in terms of sexual relations that are playing around? Is this a promiscuous episode that it's not that uncommon in teenagers, men and women, of course, but
this is happening since very early developmentally for her.
So this
quality that we kind of knew was happening. And that's why I was thinking in the spectrum as a woman and the anxiety, always anxious. So to me, is how do I put her story together? That's sort of what I'm getting from you, and I love.
Right. So let me digress for 1 minute there, because I can't possibly put her story together to a premiere. But let me ask you a question about your story as a mom. You've had two daughters. You've had to put your skills and your love and your mothering towards two girls who are struggling with very long-lasting, heartbreaking, difficult conditions.
Correct.
Do you have any idea what the meaning is of why you're having to go through this and suffer? Why is this your path?
I have no idea. I asked God, why? What are you trying to teach me?
And what when you work on that level, what kind of answers can you come to?
What kind of answers? It's like, can I handle this? I don't know. I think wow.
That one's about your doubts, your anxieties. That's not about your purpose.
My purpose has been for them. I think one of the things.
Why? But why was you?
Because I feel guilt because I've
No,
been.
no, I don't mean why do you do that? I mean, why was your life set up for the purpose of helping these two daughters? Why is that the storyline of your life?
I don't know.
Why did God set it? You sound like you believe in God, but why did God set it up this way? What's like we were talking before about wounded suffering with the wounded healer with the other person?
Maybe because I'm wounded as well.
I don't know the answer, but my point overall though is that you might find yourself more sure of what you're doing and more stable and more calm yourself if you are grounded in this more spiritual level of this is what I'm here for, rather than I'm always looking for answers